Imagine waking up with clearer thought, steadier energy, and more control over stress and physical recovery. The Wim Hof Method, WHM, developed by Wim Hof, the Iceman, claims to help people access greater resilience through three integrated pillars: breathing, cold exposure, and commitment, mindset, will. The book blends personal stories, step-by-step practices, and references to scientific studies showing measurable changes in physiology when people train consistently. The three pillars. Expanded. 1. Breathing. Practical mechanism. What it is: a specific cycle of deep rhythmic inhalations and relaxed passive exhalations, followed by a retention, breath hold. Why it matters: the technique increases oxygen availability, alters CO2 levels, and triggers temporary shifts in blood pH and autonomic signaling, which appear to modulate energy, focus, and immune markers. Basic protocol: beginner sitting or lying. Sit comfortably or lie down in a safe place. 30-40 deep breaths. Full inhalation through the nose or mouth. Fill belly, then chest. Relaxed, passive exhale. Don't push air out. Rhythm: about 20-30 breaths per minute to start, but find a steady, comfortable pace. Hold. After the final exhalation, hold your breath until you feel the urge to breathe. No force. Beginners often hold 30-60 seconds. Recovery: breath. Inhale fully, hold 10-15 seconds, then exhale and resume normal breathing. Repeat for 3-4 rounds. Variations and progress. Over weeks you can increase the number of rounds, length of breath holds, and incorporate mild movement. Arm raises during inhalations to intensify oxygenation. How it feels: lightheadedness or tingling can occur. These are common sensations. Sit, lie down, and practice in a safe environment. Always stop if you feel severe discomfort. 2. Cold exposure, practical mechanism. What it is: gradual controlled exposure to cold, from cool showers to ice baths. Why it matters: repeated cold exposure stimulates vasoconstriction/vasodilation cycles, brown adipose tissue activation, improved circulation, potential anti-inflammatory responses, and increased resilience to stress. Beginner progression. Week 1. End your normal warm shower with 15-30 seconds of cold, cool but tolerable. Week 2. Increase to 45-60 seconds. Week 3. 4. Try full cold showers lasting 1-2 minutes. After week 4, introduce occasional cold immersion, cold plunge or ice bath with proper guidance. Safety tips: always warm up afterward. Never do prolonged immersion alone. Avoid if you have serious cardiovascular disease without medical clearance, and never perform breath holding while submerged. 3. Commitment. Mindset, mental training. What it is: the habit, discipline, and mental preparation that allow you to perform breathing and cold practices regularly and safely. Why it matters: mental readiness reduces shock responses, allows for safer cold exposure, and supports neuroplastic adaptations. The technique fosters sustained practice, the major factor in benefits. Practices to build commitment. Set a specific daily routine, time, place. Use journaling and self-reflection to track progress. Pair practices with a trigger, for example, right after waking. Start small and celebrate consistency rather than intensity. Scientific context, explained, cautious. The book references experiments where trained practitioners could influence autonomic responses, heart rate, adrenaline release, and markers of inflammation. These findings are intriguing and suggest that breathing cold exposure can shift stress and immune signaling temporarily. However, effects vary by individual, and long-term clinical benefits for specific diseases remain an active area of research. Always treat the method as a personal training protocol, not a medical cure. How the three pillars work together. Breathing primes the nervous system and creates a controlled internal state. Cold exposure acts as a stressor that, when introduced repeatedly, builds physical resilience. Commitment ensures you keep showing up so adaptations accumulate. When combined, these elements create a loop. Breathing makes cold exposure more tolerable. Cold exposure strengthens mental discipline. Discipline increases mastery of breathing. Practical 30-day starter plan. Daily schedule goals. This is a progressive practical plan for a beginner who wants real measurable progress in 30 days. Weeks 1, 2. Build the habit. Daily. Morning. 3 rounds of Wim Hof breathing. 30 deep breaths. Hold. Recovery. Cold finish to shower. 15-45 seconds. 5 minutes journaling. Sensations. Heart rate. Optional. Mood. Goal. Consistency. Become comfortable with breath holds and cold showers. Weeks 3, 4. Increase capacity. Daily. Morning. 3, 4 rounds. Breathing. Gradually extend holds by 10-15 seconds if comfortable. Cold shower 60-120 seconds. Once or twice weekly attempt supervised cold plunge if available. Add short cold exposure breathing before stepping into cold water to settle heart rate. Weekly. Note changes. Sleep quality. Recovery times. Mood. Stress resilience. Goal. Confidence with breath holds and 1-2 minute cold exposure. Sample session. Set up. Lie on floor or sit. Have a timer, water nearby, and a towel. Round 1. 30 deep breaths, passive exhale, hold as comfortable. Recovery breath, relax 1-2 minutes. Rounds 2, 3, repeat. On last recovery, sit quietly for 2-5 minutes, noticing sensations. Cold exposure, do a 60-second cold shower. Focus on even breathing. Use mental cues. I decide, I accept, to maintain calm. Finish. Warm clothing, 5 minutes of reflection or journaling. Safety, contraindications and warnings. Do not practice breath holds while driving, swimming, or in water. Risk of blackouts. Do not attempt extreme cold immersion alone. Have supervision for ice baths. Contraindications. People with uncontrolled hypertension, cardiovascular disease, epilepsy, pregnancy, or serious respiratory conditions should consult a physician before starting. Stop if you experience chest pain, dizziness that persists, or palpitations. Medical disclaimer. This is training and wellness practice, not a medical treatment. Consult healthcare professionals for medical conditions.